If you often find yourself reaching for antacids after meals, feeling a burning sensation rising from your chest or throat, you're not alone. Millions of people around the world experience heartburn, a common symptom that can disrupt daily life and affect your overall well-being. But did you know that frequent heartburn might be a sign of a more significant digestive issue known as acid reflux, or more specifically, gastroesophageal reflux disease, commonly referred to as GERD? Let's explore what acid reflux really is, why it happens, and what you can do to manage or even prevent those uncomfortable symptoms. To understand acid reflux, it helps to first know a bit about how your digestive system works. When you eat, food travels down your esophagus, a muscular tube connecting your mouth to your stomach. At the end of the esophagus is a ring-like muscle called the lower esophageal sphincter, or LES. Think of the LES as a one-way valve. Its job is to open to let food into your stomach and then close tightly to prevent stomach contents from flowing back up. Your stomach is a highly acidic environment. It needs to be because acid is essential for breaking down food and starting the digestive process. However, your esophagus isn't built to handle that acid. When the LES doesn't close properly or opens too often, stomach acid can escape up into the esophagus. This backward flow is what we call acid reflux. The most recognizable symptom of acid reflux is heartburn, a burning pain or discomfort that often rises from your stomach to your chest or even your throat. Some people might also experience a sour or bitter taste in the mouth, regurgitation of food or liquid, difficulty swallowing, or even a persistent cough or sore throat. When these symptoms occur frequently, typically more than twice a week, it may be diagnosed as GERD. But what causes the LES to malfunction? There are several common triggers. Overeating or eating large meals can put extra pressure on the LES, making it more likely to open. Certain foods and beverages, such as spicy foods, citrus fruits, tomatoes, chocolate, peppermint, onions, garlic, fatty foods, coffee, alcohol, and carbonated drinks, can relax the LES or increase stomach acid production. Lifestyle factors like smoking, being overweight or obese, and even stress can also contribute to acid reflux. Pregnancy is another common time when women experience heartburn, as hormonal changes and the growing uterus can both relax the LES and increase pressure on the stomach. Some medications, including certain pain relievers, muscle relaxers, and blood pressure drugs, may also weaken the LES or irritate the esophagus. While occasional heartburn is usually nothing to worry about, frequent or severe acid reflux can lead to complications if left untreated. The constant exposure of the esophagus to stomach acid can cause inflammation, known as esophagitis. Over time, this can lead to the development of ulcers, narrowing of the esophagus, or even precancerous changes known as Barrett's esophagus. So, what can you do if you're experiencing heartburn or suspect you may have acid reflux? The good news is that there are many effective strategies to manage and reduce symptoms, starting with simple lifestyle changes. First, pay attention to your eating habits. Try eating smaller, more frequent meals instead of large, heavy ones. Give yourself time to eat slowly and chew your food thoroughly. Avoid lying down or going to bed right after eating. Wait at least 2 to 3 hours to allow your stomach to empty. Elevating the head of your bed by about 6 to 8 inches can also help prevent nighttime reflux. Next, take a closer look at your diet. Keep a food diary to identify which foods may trigger your symptoms, and try to limit or avoid them. For many people, cutting back on spicy, fatty, or acidic foods can make a significant difference. Be mindful of beverages too. Reducing caffeine, alcohol, and carbonated drinks can help. Weight management can play a crucial role. Excess body weight, especially around the abdomen, increases pressure on the stomach and LES, making reflux more likely. Even a modest weight loss can have a positive impact on symptoms. If you smoke, consider quitting. Smoking weakens the LES and increases acid production, compounding the problem. Managing stress through relaxation techniques, exercise, or mindfulness practices can also help, as stress is known to worsen digestive issues. For some, over-the-counter medications like antacids, H2 blockers, or proton pump inhibitors can provide relief by neutralizing or reducing stomach acid. However, these should not be relied upon for long-term use without consulting a healthcare provider. It's important to recognize when to seek medical advice. If you have frequent heartburn, difficulty swallowing, unexplained weight loss, persistent vomiting, or if your symptoms are not improving with lifestyle changes and over-the-counter remedies, it's time to talk to your doctor. They can help determine the underlying cause, rule out more serious conditions, and recommend the best course of treatment. In some cases, further testing may be needed. This can include an upper endoscopy to look at the lining of the esophagus, pH monitoring to measure acid levels, or other specialized tests. For severe or persistent GERD that doesn't respond to other treatments, surgical options may be considered to strengthen the LES. Living with acid reflux can be challenging, but understanding the condition and taking proactive steps can make a world of difference. By making mindful choices about what and how you eat, maintaining a healthy lifestyle, and seeking medical advice when necessary, you can manage your symptoms and protect your digestive health. Remember, heartburn after meals is common, but it shouldn't be ignored if it's happening often. Listening to your body and making small changes today can lead to big improvements tomorrow. So the next time you feel that familiar burn, consider what your body might be telling you. It could be time to take action for a healthier, more comfortable life.